All right, folks, it's Wednesday morning, a little after 10 a.m. Still in the hospital. Still got my chest tube in. I was hoping to get it out today so I can go home, but they're saying that the output of the drainage is still a little higher than they like. So it's staying in for now. Uh, maybe later today. They did a chest x-ray. That looks good. I did have I have an IV. I had an IV in both hands. Well, this one was in my arm, and then I got this one that's still in. What happened this morning is they ran blood work, and my calcium level was low. Also, my albumin is low, and my protein is low. But for the calcium, they decided to give me a calcium drip in this one. And unfortunately, the IV stopped working, and my arm swelled up. That's why it's covered. So
How's it going, Sean?
it's going. Looks like I got blood work.
We're gonna give you a bath, okay? It'll take
Okay.
10 minutes tops.
All right. Well, I got my bath out of the way. Got to brush my teeth. Yay. That's feel like grimy. I did a walk, and I did a couple of stairs. So they say everything's looking good. I just gotta get this chest tube for drainage out. So I'm all set, ready to go home. It's just that tubes. Yeah, so hopefully they'll come in later today. Take a look at the current output to see how much it's been draining. And if it's below a certain level, then I think they might take it out so I can go home. But we will see. It's 11:15 a.m. So yeah, we'll see. Like I said, I was showing you the arm that had the IV blow up on me. As you can see, the swelling is down now. So thankfully it was all puffed up because the calcium wasn't going in the vein. It was going out and under the skin pretty much. So it puffed out. But they injected it in different areas to help with medicine to help the body absorb the calcium, and that seemed to work. So the swelling is down now, and thankfully this IV in this hand is still working. So they used that to give me some medicine and a little bit ago too. So yeah, I can't remember if I told you this or not. I haven't gotten Oxy, the painkiller, since yesterday morning. Yesterday was awful. I was nauseous with it. They gave me nausea medicine, and then I was just drowsy and just out of it all day long. So I have not got any since then. It's like, no. They give me some other stuff like for the nerve blocker type stuff, and that's been helping pain. Right now, it's still pain's pretty good. So, hello, looks like I got another visitor. All right, all right. Nurse had to come in to get my vital signs. Uh, Everything's looking good. Of course, I have a low heart rate, which is normal. She asked if that was normal for me. I said, yeah, I got bradycardia. So, and she checked the drainage tube, and she says it's come down. So that's a good sign. So maybe by this afternoon, it'll come down enough to where they'll take it out, so I can be home by tonight. Crossing my fingers, folks. All right, I'm able to do the breathing thing. I got it up to, oops, this thing here. I got it up to 1750. So that's good. I still don't feel like I can take a full breath, but I'm getting closer to it. They said it's pretty good, considering I have a drainage tube still in my chest. So they said once that's out, I'll be able to breathe easier. So I hope so. So I still don't feel like I can cough very well to try to cough up any phlegm in my lungs. So, but they said I think I told you this already. The X-ray this morning looked good. So yeah, it's just a matter of getting this drainage tube out that I can go home and recover the rest of the way. So we'll see. That's all I got for now. Stay tuned. All right, folks. It's 7:45 p.m. on Wednesday, June 11th. Yeah, June 11th, 2025. I'm still in the hospital. Good news is they pulled the chest tube drain about about 2 hours ago. Uh, Initially, it was such a relief for pain. They had me roll on my side a little bit, which was very, very painful. But when they pulled the chest tube out, it was such a relief. The pain went away. I can breathe better. But as I rolled back onto my back, oh my God, the pain just exploded all over in my chest. Oh, it was awful. It was a 9 out of 10. At times, almost a 10 of pain. It was horrible. Oh my God. It was so bad that I agreed to take some oxy again. But this time they just gave me a small dose of it just to knock the pain down. And that seems to be working now. So thank God. So they want to do another chest x-ray in a couple hours after that. So about 8:30, so about another 45 minutes, they'll be in to do another chest x-ray to make sure everything looks good. Given the time of day it is, they asked if they gave me the option to stay another night and be discharged in the morning just so they can monitor me one more night considering how much pain I was in, or I can go home after the chest x-ray. So I decided just to stay one more night to be safe, and then I'll go home in the morning. So the good news is the thoracic surgeon gave me the okay to go on a cruise and fly as soon as I feel up to it. So I might take advantage of having this time off of work and take a last minute cruise or two. I got free ocean view rooms with Carnival. So when I get home tomorrow, I'm going to go online and see how soon I can book a cruise. I told her I could heal much better lounging around on a cruise ship. So, but I'll wait a few days. Won't be right away. I'm going to try to look for something maybe next week. That gives me the weekend to sit around at home and heal up some more, just to be on the safe side. Make sure I don't have to take any pain medicine or muscle relaxers. Or if I do have to take muscle relaxers, just a small dose of it to help with the slight pain. So as of right now, my pain, it's about a 5. Uh, I had to lay in bed for an hour after they pulled the drainage tube out. About 45, 50 minutes after that, I had a rush bathroom emergency, if you know what I mean, and I couldn't wait 10 more minutes. So I was feeling fine at the time. Pain was minimal. So I got out of bed and went to the bathroom, and oh man, as soon as I got done going to the bathroom, the pain in my chest came back. It wasn't as severe as it initially was when they pulled the chest tube out, but it was close. I almost didn't make it back to bed. I thought I was going to have to call that for help. But I made it back into bed and just had to sit in bed for a while. In about 20 minutes, it started to subside enough. So even as I'm talking here, the pain's coming back a little more as I'm talking because I'm breathing more. I'm breathing deeper now. So it's causing more pain. but it's still bearable. It's manageable pain. So it's probably up to 6 right now. So I'm gonna stop talking now so I can just relax. So I'll probably have one more video in the morning, or 2 videos when I'm still in the hospital, maybe when I'm at home. So here's some more for you. All right, folks, it's 12:35 p.m. on Thursday, June 12th, 2025, and I am being released from the hospital here soon. I saw the thoracic surgeon a little bit ago, and she says I'm doing great. The pain that I'm experiencing when I stand up or lean forward can be common. It's a pain that shoots across back and forth, and I guess there's a nerve in between each rib that can do that sensation of going back and forth pain. It's just a recovery process that I have to deal with. So they're going to give me some pain medicine that's not oxy and a nerve blocker like gabapentin or whatever it's called to help with that. Usually I can stand up, like I just stand up from the bed and moved over to the chair, and just that little bit of time I'm getting extra pain. But now that I'm in the chair and leaning back a little bit, the pain is subsiding some. So it's just, hopefully it'll go away in a week or 2, she said. So just gotta deal with it. So probably a lot of lounging around next few weeks. So, but she said everything looks great. So we'll see how it goes. I'm a little short of breath just because the pain I'm in makes me not want to take full breaths. So, but it'll ease up here in a few minutes and I'll be fine. So this next section will be hopefully me at home. So yeah, it's been a journey. So, but all right, here's the next section, hopefully me at home. Hey everyone. Okay, I'm at home. Sorry, I just overdid it. I ate supper and sitting at the kitchen table. Oh, my body, torso didn't like that. Oh boy. So I lay down on the couch and slept for about half hour. Got up, moving slowly, and then came to my room to put stuff away, get my CPAP hooked back up on my night table. Now I'm just laying in bed, propped up, of course. Oh, but at least I'm home. Oh, pain will subside here in a minute or 2. I just gotta give it time. I wanted to record this last spot before I put everything together for this part 2. So, but yeah, the thoracic surgeon said everything looks great. It's coming along as expected. She clarified that the thymus gland was enlarged. She took a picture of it and showed me. I forgot to ask her if I could take a picture of it with my phone from her phone, or if she can email it to me. So I'm going to do that tomorrow, I think. Ask her if she can send me that picture so I can post it for you guys. And I just like to have it too. But she said there's, as of right now, the biopsy showed no cancer in it. So no thymomas hidden, even though it was really large. If it's, with it being large, if it turns out to be a thymus proplasia, I'm sorry, I can't pronounce that word. ends in a SIA, Persia, something like that. It's where it acts kind of like a tumor and messes with the antibodies and gets the T cells all confused or messed up or something like that. If that's the case, then in about 6 months to a year, I should be symptom free from my autoimmune disease, my generalized myasthenia gravis. So, unfortunately, we're playing the long game with having this thymus gland removed, but it's hopefully will be for the best. So, but only time will tell. I can shower for the first time tomorrow. Let me just say, it's Thursday night, June 12th, 2025. See, 9, 10. Yeah, June 12th. So I was in the hospital for 4 days. I went in Monday morning for the surgery, and I was discharged today, Thursday afternoon. So we had pretty much 4 days in the hospital. I was initially told 1 to 3 days, so I knew I'd be in the long side of it, just the way my body handles surgery. They did have a hard time incubating me. No, before surgery started, they had a hard time getting the tube in for my airway. So I've had a sore throat the last few days, since the surgery. It's getting better. It's not bad now. So I can take more of a deep breath, but it's still not 100%. So it's hard. Once I catch my breath and relax, I'm better. It's just when I do just a little bit to exert myself, I get winded and it starts to hurt more because I have to try to breathe more and more deep. So yeah, it should get that. She said that should get better in the next week or two. So let's see. My incision areas are looking great. She said my incision where the drainage tube was in, and when they pulled it out, it's looking good. There was when they changed the bandage on it today, because it was removed yesterday. So when they changed the bandage on it today, there wasn't that much leakage out of it in the bandage. So that's really good. We'll see what it's like tomorrow. But she said I can shower tomorrow. I just can't douse it with a lot of water. Just be gentle with it. You can put water on it. Just don't soak it. No, don't take a bath and soak it. And don't just let the water continuously run on it from the shower head. So if I can get it wet, I can use soap and wash it off gently. And then we'll just tap it dry. Be gentle. Then let some air keep on it before putting a new bandage back on. And we'll see how it goes. The other 2 incisions are looking great. I have one. Maybe you can see it here. Yeah, an incision here. Then one kind of in here that went through the rib. Then the other one that also went through the rib, right below my breast, which was where the drainage tube was at. So I think that's it. I don't think there's another one. I think there's only 3. I'll find out tomorrow when I take the bandage off to shower. See actually how many of them are there. So, but that's my update for you folks. I'm going to end this part 2 here. I'll film some more going forward. I'm not sure how many. But, alright, if you liked this video, go ahead and hit the like button. If you want to see future videos of this journey or my other medical journeys, go ahead and hit subscribe and click on that notification button. So, all right. Just remember to live life to the fullest. Don't work yourself to death. You just don't know what's coming around the corner. I'm living proof of it. I'm 48, going on 49, and I got a host of medical issues. That's life. It's out of our control. So just enjoy life, enjoy your family, enjoy your friends, be kind to each other, and most of all, remember to tell each other that you love them. I love you all. All right. See you later. Bye-bye.